Hey, welcome back, everybody. It's 9:38. As if being active in all the heat isn't bad enough, you might have brought on some back pain as well, or maybe you have a chronic back problem. Either way, Tulsa Pain Consultants, they can help you take control of your pain. So happy to have CEO Lindsay Lewellen joining us this morning, and Dr. Martucci joining us this morning as well. He's the guy holding the spine this morning. Yeah, your spine is in his hands. Good hands, too, by the way. Appreciate you guys coming in today. Let's talk about that. Simple and expensive treatments for back pain. I mean, for people who live with that kind of pain, doctor, that's hard to believe it can be either quick and easy.
Well, I understand. It's because a lot of people, I think, have either been told, well, everyone has back pain, so live with it, or, well, there are treatments, but they're kind of invasive and they're painful and they take a long time. We offer easy, effective treatments. Most of our procedures maybe take 5 minutes in the office. People walk out 20, 25 minutes later, have a cup of coffee, get back to doing what they need to do.
Wow, that's great.
Well, we feel like overall we're able to help most people who have back pain. We're able to help reduce their pain some, improve their quality of life in a relatively simple way.
I started to say, because I have friends who've had severe back pain before, and they say it's one of the worst things that's ever happened to them, and they're facing either surgery, but having this kind of an option available to them, I think that'd be the way to go.
Well, I think it probably is, and we're able to help most people who come in, and at the very least, it's something that is certainly worth trying before you go on to other things that may be a little more invasive or a little more longer recovery period.
Okay, now I know you got the spine here with you this morning, and you were saying a little bit earlier, a lot of the things you see, and I guess a lot of the main problems that people have is in the lower back. Is that correct?
Yeah, that's right. And actually, this 2 inches here from this bottom, the bottom bone of the spine here to the tailbone, probably 60 or 70% of the problems occur right here. And what we do with some of our procedures is we might just touch this spot or this spot with a little bit of medicine to help with pain and maybe take some swelling out, or sometimes put a little bit of medicine down here where the nerves come out to the legs, because a lot of people not just have back pain, but they have pain shooting down their legs as well, and that's usually from a pinched nerve down here.
Okay, and the neat thing about it is, Mr. Llewellyn, is you guys, when your patients come in, it's not just, okay, see ya, hope everything works out okay. You guys stay in touch with them through a number of different ways.
That's absolutely right. We've actually developed a social media strategy as well as different marketing channels through which to, so that when the patient walks out, that's not the last time they hear from us. So they get updates in pain and ways to manage their pain, and ways to lose weight, lifestyle changes, things like that. Because the most appropriate approach to pain management is one that's more comprehensive. You can come in and get an injection, which is covered by most insurances, by the way, but you can really manage your pain that way.
Okay. Now, what about those folks out there watching and say, wow, this sounds like a place. Is it just as easy as picking up the phone and calling? Do they need to go through their doctor, their physician?
Absolutely. There are a couple of insurances that may require a referral, but most insurances don't. You can call us directly at 1-855-918-PAIN, and it's not necessary to have a referral in most cases.
Okay, and Dr. Martucci, I'm going to get back to you. I mean, and for a lot of folks who have, you talk about the lower back pain, the leg pain, are those the type people maybe who have already been diagnosed, or do they come in?
I think that some of them probably have been diagnosed, and one of the words we use for leg pain is sciatica. It may be a word folks have heard. But the key is, if you've been diagnosed, the next step would be, well, what can you do about it? You don't have to live with back pain. There are things we can do that can help you. So even if you have been diagnosed, the key is the treatment that we offer to actually help you feel better.
Excellent. Gentlemen, thank you both so much for coming in this morning. Certainly appreciate it. If you'd like more information, Tulsa Pain Consultants, 2000 South Wheeling. That's Suite 600, 918-855-PAIN. And that's what Mr. Llewellyn was just talking about a few moments ago. Give him a call. You can also go online to tulsapain.com for more information.